starting the work off for this led to me becoming site PI of a large multi-state RWJF funded study called Resource that I will describe briefly in this presentation. But basically it's been quite the jumping off point, I would say, for being able to really work with the Latinx population in Alabama, and has really solidified some great relationships with HICA, the Hispanic Interest Coalition of Alabama, but also Acclinate, which is based in Northern Alabama and has had some role also in the RADX project that I'm also involved with Mike Mucavero and others on this call. So the initial intent was to conduct an epidemiologic assessment of COVID-19 in the Latinx population of Alabama to inform an R01 that I hope to write to perform an epidemiologic assessment of cardiometabolic disease in this population, because they are an understudied population with respect to other ongoing studies that are happening in the US. And so it started off by really trying to understand what was happening with the Latinx population in terms of incidence of COVID-19. Really, to date, there have been almost 9,000 COVID-19 cases whose death has been verified as attributable to infection with SARS-CoV-2 and COVID-19 disease. There have been about 15,000 that have been estimated to be Hispanic Latino, but we think that is a serious underestimation of the number of people who were infected, and possibly even the number of deaths that have occurred in this population, because there has been underreporting. There were a lot of concerns that the testing sites were going to ask people for documentation. And so there was a lot of resistance in the past year to go and get tested for a number of reasons. And there is some mobility in the population. And so when people got really sick, they would leave the state either to visit people in other states where they had family who could take care of them, or where they felt they had better access to care. So the aim for this back of the envelope project was to recruit a population of Latinx using Facebook, WhatsApp, radio, and Instagram. Because we weren't doing anything in person, we developed an online survey, we being me and the people who are helping me, an online survey in English and Spanish, and to obtain consent from all participants digitally, and to also be able to contact them for future studies. And the survey consists of 50 questions that are broken down into about 5 sections. Because of the skip patterns that are built in, it's really quite a quick survey that is going to be deployed to this population. And the original planned recruitment was to do this via Facebook. We were going to use Facebook ads that targeted a sample of individuals living within certain counties by demographic and geographic characteristics that we identified, and then estimate weights to adjust the sample based on zip code, sex, race, ethnicity, etc. And then we were going to do additional recruitment to occur via Instagram, WhatsApp, and others if we were unable to reach the geographical recruitment targets via Facebook. But what we realized is that there is a bias in the sample that the Facebook platform reaches, and that really the population in Alabama is more amenable to messaging on the WhatsApp platform. And so in partnering with local groups and individuals to target recruitment using WhatsApp, we've been able to identify more individuals that are willing to be able to be included in the study. And so inclusion and screening criteria require that people fill out their zip code so that we understand where in the state of Alabama they are located. And depending on the estimated recruitment numbers that we have determined for each of the parts of the state that we're looking to recruit from, they would then be able to enter the Qualtrics questionnaire. And really there's not a very stringent filter, but ideally we want to be able to be very targeted in our approach. And then the idea is that if we are unable to reach through WhatsApp exclusively, then we'll do the targeted Facebook ads that can allow us to really recruit in a much more targeted manner. But the research that I've done this year suggests that WhatsApp is not only more popular among US Hispanics generally, but also Latinx in Alabama. And the great thing about WhatsApp is that chat messages tend to be read within 3 minutes after being sent. The average response rate is within 90 seconds. And so usually if you're using email or Facebook, it's really a very passive approach. You're sort of waiting for people to engage. And with WhatsApp, it's almost instantaneous, which has been really fantastic to learn about. Facebook is also in some of the preliminary sort of testing the waters work that I did this year. It's a very effective recruitment method of when you launch your campaign, about a third of the people engage and are likely to be recruited. But the recruitment rates for email and WhatsApp were actually really similar to Facebook. But what was really interesting about Facebook is that email and Facebook really captured a more homogeneous population that tended to be more highly educated and higher SES. And for this project, what we're really aiming for is the population that is working in the poultry plants, that are working in restaurants. You know, our audience is going to be different. And so really these last few months have been about truly understanding which the population is that we want to target, and how using social media we're able to achieve recruitment of those individuals, as opposed to your traditional audience, which you would normally capture through more traditional social media means, which include Facebook, Instagram, etc. And so we still plan to recruit a random sample of 400 individuals, which means that I have to target almost 13,000 individuals in Alabama using WhatsApp in the specific geographic areas that I'll show you in just a second. This will be representative of about, gosh, a really small percentage, honestly, of the total Alabama population, but generalizable based on geography and hopefully also socioeconomic status. So identified that the counties with higher percentages of Latino populations included these top 12. You may notice that Jefferson County is not one of the counties that's listed here, but it's understandable that, you know, relative to the size of their populations, that there are other counties in the state of Alabama that have much higher proportions of Latinx. And so when you look at the map of Alabama, these are generally the areas where you find the highest concentration of Latinx. This is to be expected, this northern part of the state. And then Jefferson, Shelby, and Chilton County also have representation. And in the South, there is much less representation. That's not to say that Latinx don't live in some of these other counties, but larger representation exists in these lower counties, Bullock, Coffeedale, and Mobile. And these circled in red are also counties that have direct links to the Hispanic Interest Coalition of Alabama, which is who I will be partnering with for this. So beyond that, I was able to narrow down within those counties which specific cities have large concentrations of Latinx as well. And these are some of the ones that were identified so far. The other really important thing that's come out of this preliminary research in order to be able to launch a very effective survey or questionnaire is that it was important to understand the backgrounds of the Latinx population of Alabama. And while it is predominantly Mexican, there's also a large number of Guatemalans, Puerto Ricans, Colombians, Brazilians, Salvadorians, and Panamanians. And if anyone speaks Spanish, you know that the connotations of words and the types of words that are used to describe certain things can vary depending on where people come from. And so it was really important in the phrasing of the questionnaire that we use language that would be readily understood by all groups that are that we might be targeting in our recruitment campaign. And so this was really enlightening because while I personally knew that there was a large group of Mexican background individuals in the state, this further nuance, I think, was very enlightening as well in terms of also the lived experience and expectations of health and fatalism and a number of other things that are very inherent to this population. So the other thing that was very eye-opening is that it is a very young Latinx population in the state of Alabama. So the median age of Alabama's Latino population is 24.9 years compared to 35.8 for Alabamians generally, and 25.8 years for the national Latino population. And so this really explains also why Facebook was not going to be the best means of reaching out to this population. Facebook tends to have a slightly older population than what you typically see on WhatsApp or Instagram or even TikTok these days. So in working through all of this, I became the site PI for this resource study, which is the COVID-19 US Resources and Protections for Vulnerable and High-Risk Population, high-risk communities, otherwise known as the resource study. And the goal of this study is to use a longitudinal methods approach to recruit 12,000 participants in California, but also 10 sites in the United States, and UAB is going to be one of the sites. The idea is to recruit individuals from low-income households, non-US born or English as a second language, and communities of color. And so in this subset, there are going to be approximately 20 individuals that will have semi-structured interviews to elicit how information about COVID-19 is being accessed, which really brings in some of the social media piece as well. And what happened when they had unintended economic and social consequences of social distancing and sheltering in place. I'm running out of time, so I'm gonna try to wrap up. But basically, the inclusion criteria are very similar for my back of the envelope award and this study, and so we timed it so that we could recruit at the same time so that we could try and remove any bias of temporal associations. If I was recruiting my back of the envelope, in months past, and the experience of the people from the resource study were going to be different, and we were hoping to compare the two populations to build a larger sample size, it was going to be better that we try to recruit at the same time. So everyone's going to be consented, ideally online. However, in some cases, there will be telephone interviews, especially for the resource study, because it is just such a much more in-depth assessment. Of the 400 women recruited for the back of the envelope award, 50 will be recruited also into the resource study, and there will be 50 African-American participants that will be recruited at in Alabama through our site that will be compared to the Latinx population that we recruit. And then we'll have comparisons to participants recruited at 10 sites across the US. So these are future directions just very generally, but I will stop there.
We have completed another month of activity with the case investigation, contact tracing. You'll see that these are the number of case interactions. A case interaction is any attempt to, it involves the pulling up of case information within the ALNBS system, which is a data collection system used by the Alabama Department of Public Health. And so you can see that we have in February a new high water mark of about 10,000, a little over 10,000, which reached the same level as we had in October. The number per day is about the same as we had in October as well. But an interaction doesn't necessarily translate into a billable case. And you'll see here that our billable cases have gone up since December, but they are not as high as they were in September, October, and November. There are a number of reasons for this. Part of it has to do with the increasing complexity of the data collection elements that are found in ALNBS. The CDC has continued to add data elements within that system that then translates into more questions to be asked. It lengthens the amount of time required for an interview to be completed, and also the number of potential errors that can be generated. One of the focus areas that the CDC has had in the last 2 months has been the jurisdiction, the county in which a person resides that has a case of positive COVID-19. It's surprising to me that a sizable proportion of the Alabama population, at least the ones in which with whom we come in contact, have not a clue the county that they live in, or they think they live in one county and actually live in another. So what we have to do is run a check, that is get out of the ALNBS system, open another browser, use another piece of software to confirm the county, because that's a recurring error that we have to fix, and that slows us down quite a bit. Our letter writing has stabilized over the last several months, but it's become more productive. Those of you who've been listening to these reports since we started, as we would send letters asking our patients to call back, historically we have had a response rate of about 10%, a little less than 10%. In January it went up to over 15, and in February it's 21.5%. So we're sending fewer letters, but they're producing greater results. That's the report, Paul.
Thank you, Andy. Go back to the first slide, if you wouldn't mind, please.
Sure.
So, Andy, does this indicate that with case numbers declining for the state, are y'all getting a larger and larger share of the contact tracing business, if you will?
No. It appears, I cannot get a straight answer from the folks that do the allocation between UAB and MCI as to the algorithm that they use to decide how many cases are allocated to each of the vendors. But the best I can tell, it's about 50-50 at the moment.
So I wanted to talk to folks. Bertha already mentioned the RADx program, which is really around testing, but there's another one called SEAL, where we're addressing vaccine hesitancy in Dallas and Jefferson County. And with both programs, they're looking for student workers. If anyone knows of any grad students that are looking for part-time employment, either doing outreach through the vaccine hesitancy or some data analysis, data pulling for the RADx testing initiative. So just to give folks a heads up, there have been a lot of town halls that we've co-sponsored with NAACP to talk to folks about vaccine, what it is not, to talk about availability, where they can find it. We've had health department officials and vaccine virologists, vaccine developers, all different types of people on the calls to address concerns that community members may have. So far that's going really well. Now that we're getting more vaccine in Jefferson County and the state of Alabama, there's been an increased push to ensure that there's equitable distribution of the vaccine. And the CDC is running this. So their favorite way to measure that is the Social Vulnerability Index. And we've been asked to verify that vaccine is being equitably distributed by SVI, which could possibly be the most complicated way to ask us to do it. But in Jefferson County, that basically means communities that run along I-5920. So that is one area in Jefferson County where we can focus. It's a little easier outside of the urban counties because they're allowing, say like Wilcox or Dallas County can be done at the county level, not the tract level. And the vaccine centers all calculate or get addresses. So for them, it's easiest to match a zip code, but zip codes and tracts don't line up exactly. But I just want folks to be aware of that, and anybody that's got interest in GIS and mapping and how the state and county folks that are rolling out the vaccine, how they could work to reach communities that might have a much higher SVI, which is the Social Vulnerability Index score.
This is the weekly report that comes out of Will Fernandez's group. And then I usually comment on, just to make note of a couple of things. This graph here shows statewide, hospitalizations are really continuing to drop off. At UAB, although the overall trend is down, there does appear to be this plateauing effect. You'll notice in this graph of daily cases, there's this huge spike here at the end, and as Andy and Jack Duncan, who provide us with daily updates on graphing, noted that ADPH dumped about 2,000 or so positive tests into the reporting system that date all the way back to last May, I think it was. So that's a reporting artifact that will certainly skew the 7 and 14 day rolling averages. I guess the good news here continues to be the relatively lower RT, the transmission rate in the green here.
Which is probably our best indication of whether or not we're approaching some level of herd immunity. That transmission rate is really the only thing we can measure besides cases.
Thanks. Really good point. At least by this measure, the Harvard Global Health Institute metrics 16.3 cases per day, which is the lowest that we've been since October. So I think there's something positive to taken from that. So you should be seeing on your screen now the UA dashboard, and Janet, here's last week's report on sentinel testing at UAB. Active sentinel testing is ongoing, and it's still ongoing with faculty as well. I got selected this past week. And this was the lowest number last week, the lowest number of positives since we've been doing it, 2 out of 1,500 positive for sentinel testing.